Good morning, my name is Daumia M. Thavraja and this is for course HLST 320, Assignment 3. The scenario is that Paul is a physiotherapy student in his final year of practicum on an orthopedic unit who is not able to answer questions regarding the documentation system. My objective is the following. Paul has completed a quiz related to his understanding of the charting form, will be motivated to increase his knowledge evidenced by performing better on a similar quiz by the end of his third shift on the orthopedic unit. Hi Paul, my name is Mia. I understand that you did not do well on the documentation quiz and are not able to answer questions. As your preceptor, I have come up with some teaching strategies based on the VARC, which is Visual Auditory Reading Writing Kinesthetic Questionnaire, that you completed, which states your best learning preference as reading writing. And therefore, I have created some teaching strategies to suit you. Now here is the College of Nurses of Ontario website, which states what documentation is and the guidelines that state that all client care must be documented in a timely and appropriate manner. Documentation is a legal document, and if you did not chart something, it means that it did not happen. Now here's the hospital policies and on documentation so that you know what is expected of you here. Next, I am going to give you this handout which explains what the DAR charting guidelines are, and you can use it to follow along and also use it as reference later on. Okay, so D stands for data. You have to first know the difference between objective and subjective data. Objective is what you observe at the significant time of the event. Examples are the patient is restless, the area is swollen and red, temperature is 39 degrees. Subject is what the patient is telling you from their own perception of events. Examples of what subjectives are, I can't breathe, I'm scared. Now A stands for action. This can be any action that has happened in the past, happening in the present, or will happen in the future based on the assessment evaluation of the patient's condition. An example would be patient has been started on oxygen 2 liters as their O2 stat was 85%. Now, do you have any questions in regards to the material so far? No? Okay. Are you able to follow along easily and understand? Yes? Great. Now, R is for response. This is a patient's progress in response to therapy. The outcomes or the goals in the patient's plan for that problem will be discussed. An example would be O2 stat increased to 97%. We will continue to monitor the patient. Now, I will give you some time to look over the handouts and then we will do a quiz with scenarios similar to the one you did at the beginning. If you have any questions before the quiz, please ask me. Thank you.